Hi everyone, welcome to the Food Allergies in Schools Compliance Training. So food allergy, it's a potentially serious immune response to eating or otherwise coming into contact with certain foods or food additives. A food allergy occurs when the immune system, one, identifies a food protein as dangerous and creates antibodies against it, and tries to protect the body against the danger by releasing substances such as histamine, tryptase, and others into our blood when that food is eaten. Food allergy is a potentially serious immune response to eating certain foods. Food intolerance is an adverse reaction to food that does not involve the immune system and is not life-threatening. So for example, lactose intolerance, right? When you can't drink milk, you have trouble digesting milk sugar. Lactose, of course, is that sugar. The symptoms might include abdominal cramps, bloating, and diarrhea. So the food allergy, do you know 90% of food allergic reactions in the US are caused by 8 foods: milk, eggs, soy, wheat, peanuts, tree nuts, fish, and crustacean shellfish. Any of these foods can cause an allergic reaction. By the way, any food can as well, but these are the top. Food allergy prevalence. Food allergies affect 8% of US children, 2 per classroom in the US, 50% among children aged 0 to 17. Food allergies and asthma in children are 29%. These have a higher risk for anaphylaxis, and 30% of allergic children are allergic to multiple. There is no known cure for food allergies right now. Management is based on strict avoidance of the food and prompt treatment of accidental ingestions, for example, an EpiPen or Benadryl. 18% of children reacted while at school. 25% of first-time severe reactions occur in the school setting. Fatalities have occurred in schools due to delays in properly recognizing and treating serious allergic reactions or anaphylaxis. Symptoms. It can occur with minutes or hours, can be mild or even threatening. Signs and symptoms. You might say itching, tingling, swelling of the lips in the mouth area, hoarseness, tightening of the throat, difficulty swallowing, a barky cough, stridor, which is that high pitch sound when you breathe in. For the lungs, shortness of breath, wheezing, coughing, chest pain, tightness. For the gut, abdominal pain, nausea, vomiting, diarrhea. In the brain, they may feel anxious, have panic, feel a sense of doom. As far as eyes and nose, runny nose, stuffy nose, sneezing, watery, red, itchy eyes, and swollen eyes. Skin, they might have hives or another red type of rash, flushing, itching, swelling. And then in the heart, they may have chest pain, low blood pressure, weak pulse, shock. They might be pale, blue in color, dizzy, faint, or lethargy. And of course, these would be very serious, life-threatening symptoms right there. So anaphylaxis is a severe allergic reaction that is rapid in onset and may cause death. It can occur within minutes to several hours, and the death from the ingestion of food can occur within 30 minutes or 2 hours of the initial exposure. Approximately 20% of anaphylactic reactions occur within 4 to 6 hours. This is called a biphasic reaction. They must be transported to the ER. So the food leading cause of anaphylaxis outside of the hospital, we kind of already went over that: milk, eggs, shellfish, peanuts, wheat, etc. Anaphylaxis can be fatal, so the person can die if they're not treated right away. Can include a wide range of symptoms like we just went over. Symptoms can be just one symptom like hives, or they can have a combination of symptoms, and they require emergency response. So an EpiPen injection, calling 911, and then the ER would observe them for 2 to 24 hours. So the risk factors would be a delay of giving an EpiPen, relying on only Benadryl and not giving an EpiPen. Of course, having a variety of peanut and tree nut allergies, maybe that are unrecognized. And drinking alcohol can increase the risk. And of course, asthma and sometimes exercise, because that can induce asthma or difficulty breathing. So groups at higher risk are adolescents, young adults, individuals with asthma, children with known food allergy, and a history of epinephrine, which is also an adrenaline type of medication, is the first line of treatment for anaphylaxis. It's naturally already made in the body, and it's used to improve a person's chance for survival. The effects are not long-lasting, and additional doses might be needed. So you give the EpiPen, and then you call 911. All staff should be trained on EpiPen. Epinephrine, or an EpiPen, like we said, is a naturally occurring substance in the body. We administer additional epinephrine in the form of an injection to increase the body's natural response to the stressful situation. Benadryl and other antihistamines like Claritin will not stop the progression of symptoms in an anaphylactic reaction. It will in like an initial allergy, like a mild reaction to a food, but if they're going anaphylactic, there is no reason to not give epinephrine. You're not going to hurt someone giving someone. So we can help decrease this from happening with cleaning measures. So washing hands with soap and water, using wet ones, cleaning surfaces with Lysol, Formula 409, commercial cleaning wipes, Target brand cleaner with bleach, and other common household agents. Liquid dish soap does not get rid of the. So creating a safe environment, ensure the daily management of food allergies in the individual children, prepare for food allergy emergencies and have an allergy and anaphylaxis emergency plan for each student, provide professional development on food allergies for staff members, educate children and family members about food allergies, create and maintain a healthy and safe education. So things to consider while students are eating in a classroom: reinforce strict hand washing with soap and water after food contact, disinfecting of surfaces after food contact is made, and blanket do not share food policies. You know, at our school we have a peanut table. So that means there's no peanuts. Well, really, it's a no nut table. Soap and water are preferable to alcohol-based hand sanitizer, as the latter has been proven to not remove allergen proteins from the hand. I'm not talking about surfaces, talking about the hands. These strategies are consistent with the CDC's guidelines, voluntary guidelines for managing food allergies in schools and early care and education programs. So we also synergize with the principles of hand hygiene and surface washing that also reduce spread. So we're using a team approach. We're training school staff, we're recognizing students with the problem, we're getting parents on an allergy action plan. You can talk about your school nurse about that. We're involving a medical provider and even the PTA and PTO. Impact of food allergies on the daily activities of children and their families. So food allergies affect everyone in the family. In surveys of parents or caregivers of children with food allergies, 60% reported that food allergies significantly affected meal preparation. 40% reported a significant impact on their stress levels. 34% reported that food allergy had an impact on the child's school attendance, and 10% chose to homeschool their children because of allergies. 59% reported school field trips were affected by food allergies, and 68% reported school parties were affected by food allergies. So the number of food allergies had a significant impact on activity scores, but the addition of other conditions such as asthma and eczema did not significantly affect the results.